was covering like roads and stuff. I'm doing that now also. So please keep him in your prayers. There's a GoFundMe site that's up. He was medevac, so he's got a lot of bills. Okay, so who would like to volunteer to do the prayer?
I would.
Or Bill. Why don't we give it to somebody else?
Dude.
So if you want.
Lord, we thank you for this beautiful day you've given us. We thank you, Lord, for this county that we're privileged to live in. We thank you for your blessings upon this county, and we just ask, Lord, that you continue to look over us as you have. We're thankful, Lord, for the people of this community, the work that they do to help here in the community. We just ask that you look over this meeting tonight, that you bless everything here, that everything said and done will be pleasing in your eyes. In Jesus' name we pray. Amen.
Amen.
For the pledge of allegiance.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Those that are new to this meeting, the rules of order are, we just ask that you be respectful of others. If you have something to bring up, I'll recognize you. Everybody gets a chance to speak. We are on a tight timeline, so we're not going to dwell on any subject. I'm always hanging around afterwards if you want to get any kind of documentation that came out of the commission or whatever, what Chester and I reviewed and what our thoughts were on it. I'll talk a little bit about that. We can always go in depth. You guys know that. So the first thing is I'm just going to go through. We had a commission meeting Monday before last, and so we did the Erlanger. Okay, so the Erlanger lease. This is that we did another version of it. It was worked on by county executive. Remember, we did not vote to accept the previous lease until May. I think we did that. I had a lot of issues with it. So I went in, as I always do, to the county executive and the attorney with my issues. It was just going down the lease, looking at the issues, and like things that I think are a risk to the county and the taxpayers. Those are always going to be the things that I look at. To me, the very front end of the lease was written as a land lease. A land lease is very different than a building lease. I don't want to dwell on that, but essentially, it wasn't clear, and with that kind of ambiguity, we don't want a land lease because you lose control of the assets. We had that issue with the first lease that we looked at. So they did change that before the meeting. There were missing drawings in the back, that was changed, but none of the issues I thought were really addressed. I can go in depth with anybody who wants to look at that. I voted no. There were, I think, 4 or 5 folks that voted no, but it passed in the end. So we have Erlanger lease in place. Basically, if I give you a summary of what we got for it compared to the Park Ridge offer, was we got half the fair market value, which was $15 a square foot. There was no commitment to do any upgrades or increase any of the, the services. That was our issue all along with that. We voiced that at the last meeting that, when the lease got shot down, the original lease a few months or back in May. There was also clauses in there that they talked about triple net lease. This thing was never, in my opinion, a triple net lease. There were too many things that weren't identified. There was language in there, which I pointed out, talked about. It said, here's a triple net lease, here's everything we're going to include. And then there was a sentence, another paragraph down that said, except any asset that is on the asset depreciation list. So what is that? Well, that's the building, and it's the roof. That roof has not been, replaced for, I think it's 2011 was the last time. 2009. So just from experience that may come up in the lease, and the county's going to bear those costs. So that's why we were against this. We thought that they could have done a better job on this, and that's what we have right now. The original lease, or the previous lease, had like 10 years. This one has a 5-year, and with 365-day notice, either party, we put on notice and then, you know, basically get out of the lease. So, my opinion, that's what we need to do. And, you know, it's so conveniently after the election, that period. So, and I just say that because this will come up again, but it's not going to be addressed before the election next year, the way that thing's written. So, anyway, I think, you know, you all knew, you know, we did vote for Erlanger early on, because that's what the majority of the people here wanted. The process was flawed, the way it was an RFP process that I've never seen before, and it put the county at risk legally, the way it was conducted. So all that's water under the bridge, but just so you all know, anybody here, we've been talking about this for months now. Next thing that came up was, okay, so in front of the budget committee, we had a floodplain resolution that came up that, it's quite an extensive resolution. It's 26 pages long. We got it like, you know, a few days before the commission meeting. I was able to, and the assessor who actually has been involved in this, the county assessor, Mr. James Condra, he was out of town, so I finally got a hold of him today. He's back. But during the meeting, basically what this is the, you know, FEMA's come down, and, you know, we do have floodplain maps. You can imagine the valleys, most of the valleys in a floodplain. When I called the office, they said that really up here, there's no, the mountains don't really have that much to worry about. There's a little bit of signal that's in the floodplain. Up here, I don't know of any areas in the base floodplain. Now, if you get into the 100 and 500, you know, like some of the creeks, there may be some, but it's not, you know, we're not in danger up here. It's up high. But what this is FEMA's come down, and since, you know, the hurricanes and all that kind of stuff, and the damage that we've had in the last, with Hurricane Helene in particular, they've come down and they want greater enforcement. We've had access to the National Flood Insurance Program. That was done back in 2010 or 11. That means that if you are, you know, the county has access to that insurance, and the residents that live in the floodplain or have any property do have access. This is an updated version. What I don't like about the language in here, and I think it needs clarifications, it talks about zoning, but it talks about it in terms of floodplain zoning committee, Regional Board of Zoning Appeals. And what they did is they just took this, what FEMA sent them, and then it passed down through TEMA, which is the Tennessee level, state level organization. And then it went to each county and city, but I think some of this language needs to be adapted because, you know, what does that mean? Zoning, you know, regional zoning. Does that mean that this is just for floodplain? And I asked that question and I haven't gotten an answer back yet. Or does that mean that we're going to have zoning, you know, that's Mission Creek, and later down the road they're going to decide that it applies to, because this particular resolution only applies to the unincorporated areas. So it does not apply to the city of Dunlap, the way this is written. So I think there's still issues to be worked out. There will be a public hearing, which I urge you all to go to in October. It's a Thursday. It hasn't been promulgated yet. I believe it's the 23rd of October, Thursday. Okay, so again, it hasn't been promulgated yet. It'll be on Facebook. It'll be when we get when it is, then we'll publish it on our sites up here. So that's one to look. If you want to look at the draft language the way it exists now, a copy here. Anybody want to look at this one? Okay. All right. Well, let's hear it. Okay. The next thing we did was charitable non-profit rules. If you remember back in when the budget committee started its budget process earlier this year, late winter, early spring. One of the things that was brought up was we make donations to nonprofits, and they've been doing it for years. But some of those nonprofits, I mean, there's law in Tennessee. There's Tennessee Code, I think it's 57109, but it basically has rules for, who you can donate to and what the rules are for how you make those donations. We don't have a policy for that. So we were donating, and then I do my homework every time I go to any of these meetings or before the meetings or when there's an issue. When I looked up the IRS status of these organizations that were on the list that we donate to, many of them were not 501c3 charities. So by law, they weren't an organization that we could appropriate money for. So that that was brought up, it was voted, tried to get out of committee, we voted, we said, well, remove those organizations that aren't in compliance with federal law, and the rest of the commissioners didn't think they didn't do it. So we did make those appropriations. Those organizations there's another separate resolution that calls out the 501s that you want to donate to, and that was passed. Chester and I voted no for both of those. I mean, it's against the law, so I mean, to me, it was clear cut. If the law doesn't allow it, then we can't, how can we vote for it? It doesn't make any sense. So what they want to do now is put policy in place, which is we recommended to put policy in place for next year's budget cycle. So everybody knows how it works, and we put that out there. Hopefully, I can get the work done.
How many nonprofits were on the list versus what you know?
There's like 10 or 12 of them. I didn't bring that. It's about $360,000 or so. Don't quote me on that exact number, but I remember that number from our deliberations. It could have been more. I just have to go back and look at it.
It's a lot of money.
It's a lot of money.
Well,
Is there a committee that decided who gets the money? I mean, that does research to find out if they're...
But research, no, except this district. Is there a committee that basically, they're supposed to, the way it's supposed to work by law is the county's supposed to produce guidance like early before the budget cycle starts and say, here's kind of what we want to focus on. If you're a nonprofit and you want a donation, here's the areas that we want to, make those donations for. So then once that's promulgated, they're supposed to send in a request. We want X amount of dollars, and they're supposed to explain what they're going to use that money for. And then they have some other paperwork. They got to, produce their federal and state, that they are 501c. So they're supposed to submit that. They're supposed to submit. It's not the way it's done here now, but this is what I'm saying, what the law says that they're supposed to do. And then the committee would decide, the budget committee is the way it's been done, it's Squatchy decides. But in the past, it was just whoever submits, that they get it. And then I actually looked in the files, and I could not find a paper trail that said, any of those things were done. There were letters in there that said, I want my $55,000. But then there was nothing else, and then, the check was written, and that was the extent of the paperwork. I just don't think that's right. I don't think that's right for the taxpayers, and I can't support that,
So Linda, if we're making donations to a nonprofit here in Sequatchie County, then that has implications for us on our taxes. Is that right or not? Like if we're donating to someone, to whatever in Sequatchie County, making a donation, does that have implications for the people who are making it?
Personal,
Yeah.
Get a receipt that you're, I don't know. That's a accounting question. I really don't know.
When this money is doled out, people, they get $55,000. Do they have to account for the money they spend and send it back to the county? Or do they just spend it any way they want?
you have how it's been happening and what the law says. They're supposed to they're supposed to then send paperwork back, right, that says here's how I spent the money, right? And that, I mean, to me, it's just common sense, right? It's like you ask for money, here's what you're going to spend it on, and then we're going to hold you accountable and make sure you spend it on what you said you're going to spend it on.
Do we have an auditor to check that?
We have an audit committee. We have state auditors that come down, but it's never been flagged, as far as I know, as an issue. I mean, they have a lot of stuff that they look at. They may, unless this is flagged to them, they may not, look that far into the records, right?
Yeah.
They primarily, they look at how the transfers are being made between line items. Do we do the budget, right? Tennessee law says that we have to have a balanced budget, which we did. We just got a letter saying that, you're good to go. It's posted. If you want to see what our budget is, go to the comptroller site, Tennessee Comptroller, go down to Sequatchie, and then you can see what the approved budget is. So I have a copy also, but it's, it takes a while. I don't think you want to post it, right? If you go to the comptroller site, it's on there. We posted it last year. It took like over an hour to get it. Yeah, so I have it if anybody wants to see it. I didn't bring it tonight, but if you want to see it, I'm happy to share it with you for everybody's. Okay, so Emergency Services Committee. So a lot of issues that we have are in the emergency in that lane. I asked for a committee meeting way before this last commission meeting, and I was told that we're not going to have one. Because the head of the committee decided he didn't want it. I know that it was a busy schedule, but to me there's several issues that they're interrelated. Erlanger lease, because we have Puckett ambulance lease that's coming up next year, and they're occupying a part of the building that, if you remember when this whole hospital RFP started, they wanted to, we bought a property, the county bought a property last year. It's adjacent, it's called the Williams property, it's near the hospital. And the plan back then was to take Puckett and move them to that property, free up that 5,000 square feet of space, so the hospital, when the lease was put out, that, whoever got that could expand, because that, there's not a whole lot of beds there now. They're pretty much maxed out, even with the medical services that they provide. So that was the plan. So that didn't, those things have to be worked together, right? Because of the time frames and then how long the RFP process takes and all, but that's not how we did it. We did the Erlanger lease. So now I suggested that we need to meet to work out how we're going to move them, and then they wanted to go to a direct contract, which is illegal. So with the research, we definitely need to go to RFP. I spent a day in Nashville this week going through Tennessee procurement rules and process. So if anybody wants to see that research, why we got to go to RFP, it makes sense. And then, find out, who the ambulance service will be. It goes to go through that RFP process and we make a selection. So that's pending, and you all need to follow these committees. These are big issues. Any questions on that? There's some other items that, I've got the email that I sent in the response I got, if anybody wants to read it. Anybody? Same thing with the road committee, next item. Chester has asked for the last 2 cycles of commission meeting to have the road committee meeting, and, it was basically, the committee, he was told that the committee was not going to meet. I was told that we are going to have a road committee meeting before this next commission meeting in November. I know where you've got issues there with privatizing that road. There's issues up here on the mountain, we know that. I did meet with, since Chester's out of play here for a few more weeks, I did meet with Eric, the road supervisor, last Thursday, And it's the same, same sort of questions. If y'all remember, if you've been following our meetings here, is last year, it's been over a year worth of effort talking back and forth to Eric. And the commission in general, the county executive about when are they going to fix these roads. Henson Gap Primary Road, okay, that was first on our list. And we sat down with Eric like this time last year and went through this list. We had some things that we were going to do here. We were going to take and put forth right-of-way resolution, road right-of-way, which we did in the past. And then there was a severance tax resolution that passed. So that was basically to direct more money into the county supervisor's coffers so he can do, fix roads, right? Have more resource. The other thing that we did is the back of Henson Gap that goes down into the valley. That's going to cost a lot of money, and that has not been funded for a long time. We actually went to our legislators one-on-one, explained that. They did work that through the legislature. This summer, I know I saw that road on what's called the pavement plan. You can go on the state site, and it was on there, so they did their part. They got on the pavement plan. But at the end, like when they were getting ready to, at the end of the year, they had more roads throughout the state of Tennessee that needed done than resources. What they decided to do was to take all the other roads off of there unless there were state roads. So the only thing you'll see in that pavement plan is they prioritized anything that was a state road. That's what they're going to spend money on. So Henson Gap, we're back to square one with that. That's the backside of it. The other thing is they're going to start soon. They were over on Fredonia last week. They've been paving, all summer. They're supposed to start Henson Gap from about up here at this intersection, go 3 miles, which we had 4 miles on this list. Just a year ago, so stuff has gone up, and there's, it costs more, so this price was not, the resources aren't there to resurface the road, to do the whole road. It's going to be 3 miles, and I asked him, when are you going to do the rest of it out to the county line? He says, well, we'll have to look at it next year. So we need to stay on top of that issue. I can't emphasize enough. Many of you have gone to commission meetings, brought it up. We've gone to committee meetings. We need to keep doing that. Squeaky wheel gets the grease eventually, right?
When did he say he was going to start paying that?
He didn't give me a date when he's going to move the equipment off Fredonia and move it here and start that.
You know how much he lacks over there?
What's that?
You know how much he lacks over there?
How much?
How much paving does he lack over on Freedom? You don't know?
I don't know.
Yeah.
You can ask that. I don't know. I honestly he's going to do 3 roads, he told us. He came up at the commission meeting, he uses the report, we weren't on there, again. So we're always going to ask the question, what are you going to do here? And he said 3 roads, Shadowland, which is on this list. He said he plans to do Window Rock, but it's not in his budget right now. He needs resources. Okay, so that means that either the county's got to put some money in there. Right now, the county doesn't contribute any money to the roads here. It comes from, gas tax, state aid. It comes from the state. That's pretty much where he gets his budget. So that's the situation right now. Until, I think you all know what happened on Window Rock. It was kind of like they had the SVEC. There's been, there should have been action with them, working with them. They did do a little bit of work, but there's a lot of places that road needs, some of the base needs to be done before they even start resurface. So that one is, I don't have a good answer for you on that. That basically throws it back into the lap of the commission.
Linda, I have a question. Doesn't Sequatchie Valley Electric and TVA have some responsibility to the damage that they've done to the road?
They do,
here
that's what I'm
and
saying.
down into
That's what I'm saying, and the water company, right?
Right.
They're supposed to, even if they're subcontractors working, they should be, if there's damage, they can go tap the bond that that is usually in place with those companies. So, you know, if y'all want Eric to come to the meeting again, but I mean, we've had that, he's been here, I think, 3 or 4 times, right? And we still don't have the roads fixed. We've got patches. I think we just need to continue to hammer on that. You know, there was an email that, some of you are aware of an email that got sent by a private resident and a bunch of people to all the commissioners and elected officials. And it basically said that the commissioners aren't doing their job to get these roads fixed. I can tell you that I have no direct responsibility for the roads here. So I'm not saying that, you know, I advocate for this district, but we're not, you know, the state, even the county cannot direct the road supervisor to do anything. He's not, you know, he's not in our chain of command, so to speak. He reports to Nashville. That's where his boss is. So, I mean, this is the kind of, you know, we meet with them, we sit down with them. We're supposed to prioritize those things. So the fight really needs to be at that level. It needs to be, you know, we need to continue to follow up with him. And, you know, residents need to understand that we do what we can, but we can't force him to do anything. We can't, like, pass a resolution or anything like that because he doesn't work for us. He's responsible to the state for the roads in the county. But we, you know, we don't, other than having, you know, keeping a good relationship with him, he really doesn't work for us in any other way, for the commission at least.
But he is elected, is that correct?
He is elected, yes. We have an election coming up next August, all of us, everybody, all commissioners, county executive, all the elected officials, sheriff, we all do.
Could we reach out to like, maybe the Navajo or Indians and have them know, because it's a historical trail, and I said, yeah, can we mark the historical Indian state funds?
I don't know. The one thing that he did say is, there's one thing, and I got a note on it this week from the County Commissioners Association. There's another association that's the roads guys. Eric's on that association, and it's basically, I'll call it like a lobbying organization. They go and they, you know, kind of ring the legislature's bell on issues. So one of the things that's going through there is they want to take the real estate transfer tax. Roads is a big issue throughout Tennessee, not just up here. And they want to have that money go to the counties or consider to go to the roads. What the point of argument is right now, and it's not resolved, is who gets the money. Does it go to the county? You know, does it go into the county's 100 fund, or does it go directly to the road fund? The road guys are going to argue it goes directly to them. Some counties will take that money and do other things with it and won't address the roads. So that's what the issue is right now. It's not resolved.
So Linda, here's my question. If we want to squeak, who do we squeak to?
Historical societies?
I don't know anything about that one, but it would be the association, because they do have a voice with the legislature directly. To the Nashville, the head of the highway department.
Transportation? Transportation or highway department?
I'd have to look on the website. It would be Eric's boss, basically. And I would take it up to, you know, the highest level on that. Yeah. It's TDOT, but I don't know who in that organization's got a couple branches. All right, so, you know, we did do a lot of work on this, especially those two. The other thing about severance tax. So I checked, there's been no deposit. We passed that in March. We should have seen severance money coming in. None. There's none that's coming into the county. So, I don't know what to tell you on that. I'm going to do a little bit more digging on that. We should have had some money by now. There's hundreds of loads that come out of this county from all the quarries we got every day.
Well, where do they put that money in?
What's that?
Who do they put that money to?
Who do they pay it to? So the quarries every month send They said, basically, they said, okay, we took 1,000 tons out of the earth, so they pay 15 cents for every ton. They send that, there's a form, it's like a tax form. They send that in to Nashville, and then supposedly the way it works is they send every quarter, but we check with another county, they're getting theirs every month. So it all depends, I think, on how fast they process and turn it around. They'll take like a percentage of that admin fee on it, like 1% or something like that, and the rest goes directly to the highway department. There have not been any deposits, because I checked the record, there have not been anything that we got back.
No deposits back to the county. They got our money, but we don't have.
Well, I don't know. You know, did the quarries ever send that? Did the county notify?
Yeah, it was supposed to notify the quarries
Yeah,
of the rule
exactly.
change.
They're supposed to notify it, like when we passed that resolution in March, it should have went.
So like a few phone calls, personal to Nashville to see if they got it. If they didn't, then go back to the
I
board.
haven't had, I'm sorry, I was on travel last month and I did not, I was working something else and I did not, I just found out about this because I just pulled the records.
And
when
I'm
I
not
got
saying
back.
that's your responsibility, hopefully, but you do clean. I'm just saying, it sounds like somebody from our county needs to call the person in Nashville.
I asked Eric to call and he assured me he would get back to me and that was last Thursday. So we're a week into this drill, I haven't heard anything.
Well, you asked him to call at the commission meeting. And the
Yes.
response from the commissioner was, well, you've got the stuff that comes out of this quarry raised up 30%. I don't care if you get any money. Well, 15 cents didn't raise their prices by 30%.
A lot of that is.
So there's just a lot of bad
We
behavior.
can pull a string on that. I mean, there's a paper trail on that, right? So that
Well, I think that your point is valid. Has the business been told that they need to do this?
Right, I know. It's, you gotta do the,
You want
the trail.
Do you want somebody else to do that for you?
I would appreciate that.
You want to do that, Ed?
Wow,
Oh, I told you.
One more thing that we're working real quick, we're getting behind here real quick, is I want to thank Ed. You remember a couple months ago, we don't have any representation Northwest Utility District for water, right? They're the only water provider here for our district. So Ed put on the floor a few months ago that we all, show up because they got board positions coming open again in the fall. No, in January. Yeah. So I want to thank you for spearheading the effort to collect some people. And I think you did a great job presenting our case. We need to, it's kind of an interesting environment down there, but we've got issues we're going to keep bringing to them. So they're supposed to send us a list. We have 3 people, and I think there's 3 seats that are going to open. We get 3 resumes for each seat, and then it goes into their process, which I don't want to go into that tonight. Maybe the next meeting when we have a little bit more time. So last thing, opioid committee, it's October is National Opioid Prevention Month. So there was a proclamation that was passed at the last commission meeting. One of the things that we're starting to do is provide public education and awareness. We have the 2 folks that work every day or every week on the ground here in Sequatchie County, and I want to turn over the floor to them. So we have Eliana, who is a volunteer behavioral health liaison. It's on the board if you don't know when they're in the county. And Sandy, who's also an asset, is a state asset, it's a RISE Navigator. And they're going to talk about what they do, how to get help. You guys can ask questions. And
Hi, I'm Eliana. I'm a volunteer behavioral health. I'm your behavioral health liaison for Ray and Sequatchie counties. That's going to change next month. It's going to be Sequatchie and Bradley. Okay, so some of the goals and objectives, we don't have a lot of time, so I'm going to try to get through everything as quick as possible. But I would like to inform you guys of the current trends and statistics that are regarding opioid use in Tennessee. Explain the different treatment options that you have available for substance use recovery. That's including our detox, CSU, MAT, IOP, IP therapy, peer support, and sober living. And we'll get into those acronyms a little bit more in a minute. explain the different common misconceptions, realities associated with each treatment modality, compare outcomes and accessibility of various treatment services within the region. So these are kind of our trends that we have going on. These are from 2003. We don't have a report for 2004 yet. But our total opioid overdoses in 2003 were 2,930 opioid-related deaths. 63% of those deaths involved fentanyl. Tennessee is in the top 10 states for drug-related overdose deaths. The overall overdose deaths in 2023 in Tennessee were 3,985, with 75% of those deaths being opioid and fentanyl related, both from illicit and prescription opioids. Prescription opioid deaths in 2023, 645 deaths in Tennessee were attributed to the prescription painkillers. Non-fatal overdoses in Tennessee in 2022, there were 26,211 non-fatal overdoses treated in hospitals and emergency rooms. If any of you guys have ever been to Erlanger, you know how small that is, and you know how much of a burden that puts on that healthcare system. One thing that I do want to tell you that's a little bit more personal is Sequatchie County. About 2 weeks ago, I was working in the jail, seeing those inmates, and everyone I saw that day was in active withdrawal from fentanyl. So these are the different substance recovery options that we have. We have detoxification, MAT, which is medication-assisted treatment, IOP, intensive outpatient treatment, inpatient treatment, which is your Cadis, your Buffalo Valley, stuff like that, peer support and peer recovery. I would also include with that your NA groups and stuff like that, because that's always going to be within the community. And then we also have our sobriety houses and sober living. It's okay. That's just making me mad. So detoxification is a medically supervised process of safely managing the acute physical withdrawal symptoms of someone who stops using alcohol or other substances. The goal is to clear drugs and or alcohol from the body while managing symptoms safely and medically stabilize the individual. There are several benefits that come with detoxification. During that process, they check vital signs and hydration. Those are monitored throughout the stabilization process. This helps to prevent seizures and delirium. They can use medication to manage the withdrawal symptoms so we can mitigate those tremors, anxiety, nausea, pain. Then we stabilize sleep, appetite, and hydration. This is a bridge to treatment. This is not actually considered a main treatment. There's a bit of a risk when it comes to detox. Once you detox, those substances are no longer in your body. So when you reuse again, you have a higher risk of overdose. So it's essential that there is follow-up care. So medication-assisted treatment, usually referred to as MAT, that treatment utilizes a combination of medications approved by the FDA and behavioral therapies to treat and mitigate the withdrawal symptoms associated with opioid use disorder and alcohol use disorder. It reduces opioid use and overdose deaths. It decreases criminal activity and disease transmission, and it improves retention rates in treatment. These are some of the common medications used in MAT. Some of the myths that we often see with MAT is that it just replaces one drug with another. That's not true. This helps to the medications that are utilized helps to stabilize the brain chemistry. People on MAT aren't sober, but recovery goes beyond abstinence. MAT is not a short-term fix. You can actually be on MAT for a long term, and that helps to reduce relapse. This is not an abstinence-based only treatment. Many people believe that works better. MAT is actually the gold standard for recovery. Intensive outpatient treatment. This is something that is actually available within Dunlap. How do you judge that down? So we do have intensive outpatient here with volunteer, and then there are other hubs that have it as well. It's a structured outpatient level of care that is more intense than regular outpatient services, but it's less restrictive than partial hospitalization. With IOP, you're going to have multiple therapy sessions throughout the week. Usually this is 3 to 5 times a week. That also commonly addresses co-occurring mental health disorders. IOP is accessible to those who have everyday commitments, so if people are working, they're taking care of their family, they're having other appointments, they can still attend IOP. It's often more cost-effective than residential or inpatient treatment. It helps to reduce relapse rates. It's evidence-based and has been proven to be effective in treating substance abuse disorders. Inpatient treatment, that's your Cadiz and your Buffalo Valley and those other inpatient hospitals. Inpatient treatment is structured live-in program for individuals with substance abuse disorder where patients can reside 24/7. These facilities often provide intensive therapy, medical, and psychiatric support and provides a safe and substance-free environment preparing clients to transition to lower levels of care. Basically, when you're looking at IOP, you're looking at a combination of all of those outside services. IOP, many inpatient have MAT, many of them have therapeutic services. They often use a holistic approach. Living and recovering with peers fosters support, camaraderie, and accountability, increasing retention and treatment. This also increases motivations and reduces feelings of isolation for those that are currently going through recovery. Transition and aftercare planning are provided when the client is ready to step down to lower levels of care. There should always be a follow-up after inpatient treatment. Substance abuse recovery is an ongoing treatment process. And then we have our sober living houses. Sober living is drug and alcohol-free housing that allows individuals to recover from substance addiction to reside in a supportive and structured environment. It's similar to residential treatment, but allows for individuals to still keep their commitments in the community, such as going to their appointments, maintaining employment, and meeting with professionals that are involved with their care. So they would have case managers, if they're on probation, they'd still be able to attend probation and things like that, or they can be checked in on and make sure that everything's going okay and they're able to maintain sobriety. Residents of sober living are able to maintain their responsibilities. It is more affordable when compared to inpatient treatment. It offers additional life skills. Many times sober living houses teach things like budgeting, job seeking, communication skills. Some of them have resume planning and other activities within the community. It offers a safe, supportive, alcohol and substance-free environment. That's all I have. You agree? Is there any questions? I know that was pretty quick.
Go ahead.
And I don't have particularly, y'all do, there's so many things with this addiction involvement that it leads to mental health and problems and this and things. So y'all offer other things, as far as insidious stuff like that. What kind of things are you?
So, out of the things that were listed here, Volunteer Behavior Health does offer MAT at every one of their hubs. So they're able to provide that to the community. I actually work crisis. Substance use falls under crisis in our continuum, which means I could actually get you into inpatient treatment. I could get you into the detox services. I could get you into sober living and things like that. So all of those are available here in the community.
Do you have a card or a contact number?
I do have a contact number. I'm still working on the cards, but I will get you a contact number. You ready? Yeah. Any other questions, Jen?
I do. I mean, I appreciate your presentation, and I think it's really, it's great work, obviously. What is the purpose for presenting to us today? Do you need our help? Are you just presenting the information because it's required?
I'm actually presenting the information so that you're aware of the difference, because many times people believe that the only route to recovery is through inpatient treatment, and there's so many lower levels of care. And that is a standard that Tennessee has, is that we go with the least restrictive environment. So I'm just giving the information so that you guys know that there are other options out there.
But I'll speak to the other side of that question from the county perspective and the opioid committee. As members of the community, if you know people that need this help, Eliana sits here, the schedule's posted up there, it's out on social media. She's helped people. We want people to come use the resource. Sandy is down at the health department. Also, Eliana covers the jail. Right now, we got a whole on Tuesday schedule, but pretty much throughout the week, they're also on, you can get a hold of them on their numbers. That information is out there on that flyer, and then also out on social media. They'll give you their cards. Please contact them if you know people that need help, whether it's your family. Even if you're a family member, not the user, and you don't know what to do, they can help you with that. They can help you understand what to do.
I'd say one thing on that is a huge problem with the addiction issue that we have is lack of education. The majority of the public just do not understand addiction, and they don't understand treatment and all the things that go with it. And that's a big hindrance to our efforts to try to improve this issue. So having these ones come out basically was to try to educate this community and let you all go out to your neighbors and friends and family. Every little bit's going to have its own benefits.
So just think of me as like your bridge. If you have people that you know need help, that they're seeking services, they're like, hey, I'm ready to get it together, go ahead and get into treatment, I can help them with that. And I'm here in the community and I'm here to serve y'all.
Also, I'm in contact with a lot of faith-based ministries. My son went through one. He was in the program for a year, and then he got in and actually served and worked with him for about a year and a half. There's several really good programs. I don't know personally of any here. There are two that I know are in Knoxville or Kodak.
Okay.
Restoration House Ministries.
I am familiar with Restoration House.
And so we have all the contact information. I know the director of Restoration House Ministries, and I try to direct people any chance I get. If anybody knows anybody that is willing to try it, I mean, it's a year thing, and most people aren't ready to do that. I've sent 3 people down there and 2 have come back.
Right. Yeah.
So, but the ones that stay, there's a really good recovery rate. It's like a team challenge.
That's awesome. Okay. Yeah. The great thing about volunteer is they don't affiliate, so we're able to access all of the resources that we possibly can without them restricting us.
That's
It's
awesome.
lovely.
I brought a couple of people up here from the community, that these people, that they have helped. And even if somebody don't have any kind of insurance, or any kind of, a couple people live in campers, and just up there, don't have any kind of, I've actually got up here, and they help them, put them up with whatever they need, get the insurance, whatever, that they need. So they come up here Tuesday and Wednesday and set 2 hours. And so anybody in the community that needs any help, be sure to send them up there to this guy here over time. Sure to help them. They do a good job.
I'm here on Wednesdays from 8 to 11, and then on Mondays I'm at the health department all day.
And very quickly, we put our first video out from the sheriff's office about 3 weeks ago. Actually, Rick was my first victim. So we got a really good response from that. We got like 165 shares, so it reached a lot of people. And that's what we're trying to do, is educate people. We're going to be doing that monthly. So our next one will be coming out probably late next week. So we encourage people who have not seen it, go to the Sheriff's Office Facebook page and just go down until you see me and Rick sitting there at the television. You'll see a good little video. It's about 10 minutes.
All right.
Good night. Hi, so my name is Sandy, and I'm a RISE navigator with the Tennessee Department of Health. My partner in our southeast region is Caitlin Tate, that's why her name's up here also. Go ahead. So basically, I'm just going to give you a quick introduction as to what a RISE navigator is, the navigation process, kind of how we work, our successes and barriers, and our targeted outreach. So for the southeast region of Tennessee, we cover these counties: Meigs, McMinn, Gray, Bradley, Marion, Grundy, and Sequatchie. I personally have Marion, Grundy, and Sequatchie. And we sit in the health departments and we provide treatment referrals, either like she was talking to, all those different treatments that she was talking about. We also do harm reduction, education, we link to resources, and then we provide support to reduce harm associated with substance misuse in a very non-judgmental atmosphere. So harm reduction, and this, like we're talking about just educating people, harm reduction is basically allowing the client to be they are in charge of their own treatment. We don't push anything on them, we go at their pace. So when they come in and they're not ready to go to treatment, we want to prevent them from harming themselves. So we will teach them how to and give them the tools they need to prevent overdose. So we realize that, and a lot of that's sticky for some people. They're like, wait a minute. So we're going to teach them how to use the drug safely until they're ready to make that next step, because the last thing we want to do is to overdose and give them those fatal overdoses and not be able to come back. So referrals are made for me, referrals can be made from the inside of the health department through our nurses and our providers, or it can also be made from the community. I have flyers here. They're at the desk there by Linda. You can take those, you can hang them up everywhere. My number's on it. They can call me directly. I have a cell phone number that I have with me all the time. They can make that phone call, and it's 100% confidential. It's 100% free. It costs nothing to come and talk to me. The client is engaged as an expert of their own experience with substance use by utilizing motivational interviewing and stages of change. Basically, I talk to them and find out where they are. Where are you right now? What are you thinking? What do you want to do? And that's how we move through the process. We also use Maslow's hierarchy of needs, which we won't get into real deep, but it basically just, again, is a tool that we use. This is how our navigation process works. At about 2 o'clock area, you can see the actually the top. They get referred to us. Somebody identifies them either by themselves, a nurse. Somebody identifies them as needing to talk to us. Once we talk to the client, we're gonna, like I said, we're gonna identify what kind of resources they need, where are they, and then we work with them to move on through the process. Whether it's just education, health information, or if it's the treatment referral. And then we're going to guide them through all that treatment referral, get them into the treatment, whatever, whether it be the IOP, sober living, inpatient treatment, whatever it is, we're going to guide them through that. And then when they come back out, we're still with them. So I'm not just going to send them to treatment and say, hope you do well. We're going to keep up with them, and then when they come back out of treatment, I'm there for them again, because now they're at another state. Okay, I made it through recovery, now what do I do? Maybe they don't want to go back to where they were living before. Now they need help finding a new place to live, they need transportation, they need employment. So we're going to help with those social services also. This is the hierarchy of Maslow's hierarchy of needs. And we're basically, when I talk about that, if somebody is living, I think someone said, living in a trailer, living in a camper, with no water, no food, whatever, no heat, it's ready to be cold outside, and they come to me and they're like, I need to go to MAC therapy. Well, but then they tell me that they haven't eaten in 3 days, they don't have water, and they're freezing. We're going to discuss that, and like right now, the best thing that would be for you, we're going to use those kind of information, the interview in and everything, and discuss with them that the best treatment for you would be to go into a residential area where they can provide you these basic needs also. Okay? Not forcing them, but talking to them so that they are understanding what's going on. This is just some of the things that we do. We try to provide strong relationships with our community partners. We provide linkage to care, and then increase empathy with education. And that's kind of what we're doing, Eliana and I are doing tonight. We're trying to increase that, increase empathy through education. Some of the barriers that both of us can help a client go through, as someone mentioned, lack of resources, insurance. We don't want someone to not to come to treatment because they don't have insurance, or they don't have a way of paying, because we have the resources and we have the information needed that we can get them to that care without worrying about that insurance being a barrier or financial barriers. Transportation, housing, and then we're trying to reduce the stigma within the community. And again, this is, it kind of got messed up there, but this is Caitlin's information. If you're in McMinn, Meigs, or Ray County being just right down the road there. And then of course I'm in Grundy, Marion, and Sequatchie County. Any questions? Morning. I do have the flyers, like I said, you can post these. These are new. This is okay, right? So these are new. So it does have my information here, but so to remain that confidentiality, they can scan that barcode, and it asks like 4 or 5 questions, and the information comes straight to me. Nobody else. Nobody else has to see that information that they're reaching out. So we find that maybe if you ask somebody directly, do you have a problem? And they may, oh, no, I don't have a problem. Well, go ahead and take a flyer. And then when they get home and they're in their privacy, they may actually reach out, but not want to, just for that fear of what's going to happen, especially in like a health department or law enforcement or anything like that. They're afraid of what, if I say yes, what's going to happen right now. So, and then we also provide, through my harm reduction, we do have the opioid reversal, which has Narcan, it has a face mask, some gloves, and then of course fentanyl test strips to make sure that if they do use fentanyl, we want to make sure, or they're not using fentanyl, some people do, but if they're not intended to use the fentanyl, they can test to make sure it's not in the drugs that they're using. Or to make sure that that's exactly, they know what they are taking. Any questions? I can show you, Rachel's probably better to talk about that.
Well, yeah, I've got some kits here tonight, so if anybody's here tonight would like to have a kit, we have those, and then we have the nasal spray, naloxone kits, and so we can basically, yeah, 2 doses are in a kit. It's like any other nasal spray, just spray it in the nose. You don't want to prep the kit. The nasal spray, you only have 1 dose. You have one spray. So if you spray it one time, you don't need to practice with it. But there's 2 doses in each kit. This is what's sold, over the counter now in Walmart, somewhere like that. It's about $30 a box. If you go buy it from Walmart, we have them for free at the health department all the time. You can come back every day if you want one and get one for free. But yeah, you want to make sure that if you are spraying it and using it, that you're calling 911, because this has like a 30 to 45 minute time frame that it will help reverse that opioid overdose. And then someone can actually go back into an overdose and stop breathing after the 30 to 45 minutes after this wears off. And that's unfortunately what happens. Sometimes people die because they've been given this. People think they're okay, they leave, and unfortunately the person stops breathing 30 to 45 minutes later. So if you're using this, you need to be calling 911. And this is safe to use in children and adults. It doesn't really have any side effects. It's not going to hurt to use it if someone's having a heart attack or a stroke or something like that, asthma attack. This isn't going to hurt them. Better to go ahead and use it if you think it could be an overdose than to not use it. So, yeah, and just to address your question really quick, so the county opioid funds that have been voted on are helping to pay for the service that she's providing through volunteer behavioral health, and your state opioid funds, there's a state allotment is paying for Sandy services through those county health departments. So that's kind of what your money is going to, is paying for the services for these, for these individuals to help, be that person that gets them whatever they need, whatever they need treatment, whatever that may be, so that families, at work, whatever, you're not having to spend time trying to find out what to do and trying to navigate this system that's very complicated. That's what they're being paid to do, is to navigate that system for you.
And it's not tax money. I just want to make that distinction. So the money comes from basically legal settlements. The program lasts about the money will last about 18 years, but we get less and less and less every year. It's starting to trail off. We have roughly 400,000 for this county, for a small county. And Rachel, you didn't introduce yourself.
I'm sorry.
Rachel is one of our consultants.
It's okay. I'm with the state. I'm the regional substance response coordinator for the whole Southeast region, and then the navigation programs and some of the services that are in the hospitals and the emergency departments. Navigation programs through that are all under our program, which is funded at the federal level. But this is from opioid settlement, the pharmaceutical companies where they have the settlement dollars.
Yeah. So Rachel consults with our opioid committee. What she helped us in the front end was take a look at all the resources, because I mean there's so many and they're so different, to try to identify as many as we could and then figure out what the gaps are in the county. We collect data, the committee collects it, we analyze it, we look for hot spots so we know where to have these meetings, where to have these resources sit. We just got started, so it's here now in Lewis Chapel. We are a hotspot. People know that.
Yes.
And then there's other hotspots in the county. Hopefully, we can get more places, more folks here in the future. But they're trying their best to get around. They're available. I mean, you just got to know how to get a hold of them. The other thing I want to mention is we basically have, even though from two different organizations, they work together. And we got them together. When I got in place, I know they hated it, but it was basically where it's primarily sometimes volunteer behavioral health. If it's private insurance, they can't do anything, so then the next call is to the navigator. So where one can't do something, we want to have full coverage. We don't have any gaps. Nobody falls through the cracks.
Yeah.
So they work together for our county. That's the way it works.
And I didn't mention, she said where she is. I do have 3 counties, and I am for sure in Sequatchie, Dunlap on Thursdays. However, if you call me and say you have somebody, and I've got them here right now, call me, and as long as I'm not with another client at that particular moment, I will drop in wherever I am, and I will come to that. So I sit in different places because I do have to cover, but just because I'm not here, if you need me on Wednesday, like just call me.
Thanks, ladies. Thank you. This county needs.
All right. All right, so we covered a lot of stuff, not just with the presenters, but just in general. We got still a few minutes, so I'm going to go ahead and adjourn the meeting because I know people always want to talk to different people around here. I want to give everybody an
Can I
opportunity.
say something more, guys? I was supposed to speak. I'll only need like two minutes. I'll talk a little bit.
Really? Because I make the agenda, nobody told me.
Yeah, I called. Did I speak with you or someone else? I've got it written down in my date planner.
Please call either me or Chester, but Chester's offline.
It was whoever's working with Chester. It's okay.
Anyway,
I've got
so
the text.
you have 1 minute because we got to.
Yeah, no, it's fine. I'm the local Humana rep, and I used to come to all the meetings. I lived up here on the Lewis Chapel, and now I live in Dunlap. But open enrollment's just right around the corner. So all I was going to say is if you have loved ones that are on Medicare, sisters, aunts, grandma, mom, yourself, don't talk to the 1-800 number. Always make sure you talk to a local person. If I can't help you, I'll know someone who can. Network is key. A lot of times they promise a lot of bells and whistles, but you want to make sure that all your doctors are in network for your plan. So I've got cards and I've got flyers as well, and anybody that's
meeting's adjourned, and we got to get out of here without.
Got me over here.